More parents are turning to cannabis since the start of the COVID-19 pandemic. That's according to a new poll. And more than half of parents have replaced their alcohol consumption with it. So Dr. Stacia Woodcock is a pharmacist and dispensary manager for Curaleaf, and she's with us now to talk a little bit more about these findings. So, Doctor, I think we've all seen the many memes of, people working from home doing a Zoom meeting with a wine glass within arm's reach. And that has been like the narrative for how to handle pandemic stress. But now we're learning something different. Why have more parents started using cannabis instead of alcohol during this pandemic?
I think the pandemic comes with its own set of stress and anxiety for a lot of people. And I think chronic alcohol use has some drawbacks that leads them to looking into more holistic options. And one of the other things the pandemic has provided people with is the time to investigate alternative options such as cannabis and find what exactly is available to them in their individual state.
So Anne-Marie paints a picture of, those of us working from home, many people working from home, and they've got the wine glass there. Oftentimes you see on people's Instagram, they say, work life, and they've got the booze, and then they've got the laptop. But now, as we're finding out, there are people that may actually have a roach dangling from their lips or a bong at the side of the table. And I wonder, is it because people think and wonder if cannabis is perhaps less toxic to the body? I don't know. There's the science is not clear as to whether or not alcohol is more detrimental to the body than cannabis. There are some, particularly those in Congress, who think that it is, and there are others who say no. Smoking cannabis is better for you if you're going to do something like that than it is to drink alcohol.
Yeah, I think the biggest misconception is the first thing you said, and that cannabis use includes a roach or a bong. I know most people associate cannabis use with vaporization or smoking, but there are a lot of alternative options like tinctures, lozenges, capsules that don't require smoking or vaporization. And also, there's a big misconception that cannabis use also equals intoxication. Cannabis comes in multiple different ratios of THC and CBD. The way that those ratios are found within the product determines what the outcome is, and also the dosing that you choose. So through different ratios and dosage forms, you can actually use cannabis with little to no intoxication, which is not necessarily the same case with other substances.
I think that's a great point, that cannabis use has become much more sophisticated than it was when maybe people were in college or high school. But as we sort of giggle about this, the truth of the matter is we're talking about parents, and that means that there are children around, possibly children at school or virtual learning. So, can we talk about just some of the things that parents need to be aware of if their children, in the house, whether it's secondhand smoke or, whether they should do it at all when there are children around?
Yeah, absolutely. So I think the first thing is that parents should be accessing their cannabis from legal, reliable sources, right? They should be going through the legal channels within their state, getting products that come from a company like Curaleaf that's been tested and regulated and has products that they can trust, right? The second is storage. We always recommend that when there are children around, cannabis is stored in a safe, secure location. So even if it's a lockbox or a high child-proof cabinet where parents can store medication, just like they would any other prescription medication, we treat cannabis the same way. So storage is key. And then, as I mentioned, the alternative consumption routes, if they aren't able to use vaporization or smoking forms safely away from their children, they have access to these alternative dosage forms that provide them a more discreet way to use medication. So it's just like, their other daily prescriptions or daily vitamins, and doesn't necessarily present a confusing image to their children.
You manage Curaleaf dispensary in Queens. What have you heard from customers or patients who've come in during the past 9 months of the pandemic? Are they looking for a stress reliever? What's generally the reason that people turn up at your dispensary?
So in New York, only medical cannabis is legal. So any patient that comes to us has to have been certified by a practitioner under one of the qualifying conditions in New York State. Every state is a little bit different. Some medical states have more sort of lax rules where the the practitioner can decide based on what their evaluation is, what the patient can use cannabis for. New York is a little bit stricter. We have a list of things patients can qualify for. One of my favorite things to talk to people about, though, is that, when people think medical cannabis, they think cancer, HIV, AIDS, multiple sclerosis, Parkinson's disease, but they may not necessarily understand that things like chronic pain, which include arthritis and migraines and menstrual cramps, or neuropathy, which is that burning and tingling in the extremities that a lot of diabetic patients suffer from, those will also qualify you for medical cannabis. So we were incredibly fortunate in the majority of the states that we operate in. We were deemed essential in the pandemic, which for me is a huge step forward in legitimizing the role that cannabis plays in the health and wellness of people's lives. People really depend on us for their medication, for their qualifying conditions, and the fact that they were still able to access the medication even after the massive shutdown occurred was really, really important to us. So we were really proud to be able to provide that to our patients.
All right.
Doctor, during this
Marie,
last election, there were a lot of, just a quick one. There were a number of municipalities and states that had the issue of decriminalizing or legalizing or something along those lines, that issue on the ballot. I'm wondering, based on what you're seeing, is what you're seeing a reflection of what we're also seeing sort of in the legal world and in the way that society sort of feels about cannabis, that there is a definite shift making cannabis sort of way more mainstream than it was before, and it's a shift that's probably going to continue to move in that direction?
100%. I mean, in this last election cycle, the voters really spoke, right? We saw all 5 states where cannabis was on the ballot pass, most of the times overwhelmingly so. And on a worldwide level, the United Nations just removed cannabis from its dangerous illicit substances list. So I think we're seeing a massive worldwide shift, and I think at the core of that is education. It's not the stoner theory necessarily that everyone has subscribed to for so long. There's so many different ways of utilizing cannabis and so much education around it. People are starting to really understand not only what it is, but what it isn't. And I think that that's really showing in the way the voters turn out and vote, and the way that cannabis has become much more mainstream and used, particularly throughout this pandemic.
All right, Dr. Stacia Woodcock, thank you so much. Really interesting food for thought. We appreciate it.
Thank you so much. I appreciate it.